I'm Dr. Robert Hardesty, a board-certified plastic surgeon practicing here in Riverside, California. Today's topic is facial rejuvenation, looking better without surgery. Well, there are many things we can do without an invasive surgical procedure. But when we couple them with surgery, we call that synergy. 1 plus 1 is not 2, but 1 plus 1 is 4. So, I'm a firm believer in surgery when needed, but we have the largest amount of non-surgical technology in our office than any office in the Inland Empire. Our mantra is one goal, many options. So, what are these non-surgical adjuncts that we use and combine with surgery or do separately? Prevention is number one. So, neuromodulators, Botox is the most common, Dysport, Juvederm. These are all neuromodulators. How do they work? The chemical latches onto the nerve and doesn't allow the neurotransmitter to be made. Therefore, it's like driving a car around. Somebody puts a locking gas cap on it, throws away the key. Once you run out of gas, you can't drive the car. The same thing the neuromodulators work on. It prevents the lines about the face. Number 2, fillers. People don't realize, but as we age, we actually lose fat in our face. We go from an oval to a rectangular, losing it here, losing it along here, starting to get the folds because this fat remains. The face sags and gets the jowls. By using different fillers, the hyaluronics, which is the fluid that we find in our joints, we put that in and it attracts fluid. That's why it plumps it up. Sculptra actually is a collagen stimulant. Radius is made out of coral. It also brings in fluid and lasts longer. So we have a wide array of fillers, not only to restore what was missing, but to enhance the contour, such as lips. Fat reduction, Kybella in the neck. It dissolves fat. It is the same enzyme that we find in our gallbladder that helps digest a fatty meal. We inject it. We inject it in a series of 3. The first one goes and gets the first layer of fat. The fat then is gone. We come back 3 or 4 weeks later. We do the second injection, the second layer of fat, and then the third layer. Sometimes we require 4. Laser resurfacing. By evaporating the wrinkles, it stimulates the collagen. Radiofrequency sends invisible rays through the skin and shrinks the skin from underneath. So, we often combine these with surgical procedures to give a natural look. So we have the preventive side, we have the enhancement side, and we have the synergy when we add the elements of non-surgical with surgical.